Thank you very much. Good morning. I really appreciate having this opportunity to present some issues related to standards of care for children with cancer in Europe. Let me start with a few remarks on pediatric oncology in Europe. All pediatric cancers are rather rare disease, both in children and adolescents, and annually we note around 13 up to 14,000 new cases of patients in this age of group as having cancer. However, it is still the second most common cause of death in Europe, and we are facing several problems, especially with shortage of medical information, shortage of financial support, and shortage of psychological support in patients and their families. However, if we are looking at survival curves, we can see spectacular improvement since 60s up to now. In the 60s, we were able to cure less than 10% of children with different types of cancers, and currently in most of cancers we achieve a level of 80% of cure, and in some of them this percentage is higher, and we expect by 2015 to achieve a level of more than 90% cured children with diagnosis of different types of cancer. The main issue which was recognized many years ago was that every child diagnosed as having cancer must be treated only in a highly specialized pediatric oncology hematology center. And in Poland we started to create a network of pediatric oncology wards in 1962, and at that time until 80s we had rather poor conditions and facilities to treat children with cancer, with most of our wards having rooms for children with 4, 6 or even 8 beds, and all were overcrowded at that time. So the results we obtained up to 80s were rather poor and far below average obtained in Western countries. For example, in leukemia we are able to cure only 5 to 6% of children, even if we had an access to almost all drugs at that time. So we decided to prepare special requirements for pediatric oncology hematology centers in Poland with adequate substantial number of patients annually in each center, with complete diagnostic facilities available for 24 hours a day, adequate hospital space and equipment, highly trained and specialized medical staff, and multidisciplinary support for 24 hours, and of course abilities to follow up patients after termination of the treatment. We started to construct medical team for treatment of our patients, consisting of course of pediatric oncologists and hematologists, pediatric nurses, but also psychologists, teachers, social workers, play workers, generally replaced by volunteers, chaplain, psychotherapeutics, technicians, and medical secretaries. And of course, in this team, we wanted to have also parents of the child and also a patient as a member of the staff treating himself. And we introduced also multidisciplinary approach related to diagnostics, treatment, support, and rehabilitation. And cooperating team of experts consists of many subspecialties in pediatrics, and not only in pediatrics, and also laboratory diagnostic labs and so on. And of course, we also introduced into the team family doctor. It is not because only because of early diagnosis abilities, but also cooperation with Pediatric Oncology Center while patient go home. And in the future, we would like to have a family doctor as a person which will monitor for late effects these patients. We also established a special system for financial support pediatric oncology in Poland. The main payer is National Health Fund. It is a kind of health insurance which pay all reimburse all costs related to diagnostics, therapy, hospitalization, and medicine. Also, we have research grants for special purposes and national program against cancer, which is granted by our parliament each year. And this money are used for education, standardization of diagnostic procedures, nationwide prophylaxis programs for modernization of medical equipment. And very important support from parents' organizations and charity foundations, mainly for social cause, individual center support to buy equipment, devices, and renovations. And currently our all centers are much more better looking than it was before, and you can see some pictures from Lublin. And there is another center in Gdańsk which was completely constructed, built by a foundation which is called Foundation Without Barriers Communication, and led by our ex-First Lady, Mrs. Jolanta Kwaśniewska, and she decided to construct and build this ward in Gdańsk. So currently our results are comparable to obtained in Western countries, and we achieve really good improvement in all cancers. And we also decided to start an action of implementations of standards in every European country and to share some our experience in it. And SIOP Europe decided to be involved in this project. SIOP Europe is a European organization promoting optimal standards of treatment and care for children and young people with cancer. It's the only professional multidisciplinary pan-European organization dedicated to childhood cancer, established in 1998, and collaborates closely with International Society of Pediatric Oncology and ECCO. SIOP Europe develops novel strategies for cancer awareness, cancer diagnosis, and cancer treatment, which are focused on children with rare disease. We observed during last few years increasing difficulties in EU member states related to European Commission regulations. We call it as a regulatory fundamentalism, which is especially observed in some new member states. So it is a kind of over-interpretation of regulations. And also we observed inequalities and barriers for cancer, childhood cancers in information, access to clinical trials, access to drugs, reimbursement, and quality of treatment and care in different European countries. So we decided in 2008 to sent a questionnaire to all European countries just to prepare a report on status and standards of pediatric cancer unit in Europe. It was, it just followed inquiries from parents' organizations which wanted to know what's going on in European countries in this aspect. And this questionnaire was made to representatives, to leaders of pediatric oncology in every European country. We received responses from 27 countries out of 49, especially from European Union member states. We received 21 responses, and it appears for us that only in 10 countries any regulations on pediatric oncology exists. However, if we look more closely to these responses, to answers and description of these answers, we realized that only in 5 European countries regulations were issued by official legal authorities. In other 5, these instructions or recommendations were issued by societies or parents' organizations.
5 more minutes.
The most important regulations, most comprehensive, was from Germany in 2007, and well, the question is whether we need for childhood cancer any standards of care in Europe, and all responders to our questionnaire answered that yes, we need it. So we decided to call a conference in Warsaw in October 2009, and as a result of this conference, a special document on standards of care for children with cancer was presented, which covered all aspects of care for children with cancer, with different issues which were not really covered by any legal issued recommendations or regulations in every European country. So we would like to continue our project, and European Partnership for Action Against Cancer is very helpful for us. We applied to reach this project, and SIOP Europe presented competitive application, and it was accepted. So we are really happy to have opportunity to continue our work with standards of care for children with cancer. Now we are discussing how to implement all these standards in each European country. And for this purpose, we try to organize a conference which will be held also in Warsaw this year in October 2021, and it will be organized by Polish Ministry of Health and SIOP Europe, and it will be a part of EU presidency held by Poland at that time, and we expect to have representatives of every European country, not only professionals, not only parents' organizations, but also policymakers. And we would like to prepare national versions of European standards and to discuss how to implement and what are barriers to implement all these standards in every European country. And in the next future, we would like to introduce a system for certification or accreditation of pediatric centers in Europe, just to improve the quality of pediatric oncology in Europe and to have better outcome through better treatment standards and equal access to quality care. I really appreciate help from many organizations, especially from SIOP Europe Board, Polish Ministry of Health, Communication Without Barriers Foundation, many more foundations and organizations like International Childhood Cancer Parents Organization, European Cancer Patient Coalition, European Institute of Women's Health, and several local, regional parent patients groups. Thank you very much.